So, Dee Dee, we've come up with a diagnosis for you, and we're going to go over it here with you today. So, what it came down to was cervical facet syndrome, which is pretty much the posterior part or the back of your vertebrae are just kind of smashing into each other, causing some symptoms that you're having. Some may be radicular, some, like you said, are pinpoint, kind of diffuse pain, and it's typically dull achiness. It can be sharp, but yeah. So for your treatment, we're going to mostly be doing manipulation and some PIR, which is post-isometric relaxation. With this, we're going to stretch your neck a bit, have you push back into it like you push against the wall, and then you're going to relax, and I'm going to stretch you a little bit further. We're going to do this to help release some of the muscles that are kind of tight and just not working the right way that we want them to, help stretch them, get them back into place. We're going to use the spinal manipulation to help restore the range of motion, kind of free up those problems that you're having in that joint space, and hopefully get some pain relief along with it, get you back doing those things that you really like to do. We also have other options for treatments that if you're interested in, such as like what's it called? Interferential therapy is a type of e-stim, which is kind of similar. It uses electrical signals to just kind of activate your muscles and release chemicals that are similar to those that like painkillers but natural for your body that your body makes on its own. You can also go see an MD for this issue or a DO. DOs are a great option if you're looking for something in between a chiropractor and medicinal medicine. They will probably prescribe you something as well as adjust you. And then if you're just looking for the prescription route, you may just get painkillers with and some muscle relaxers with an MD and possible a PT referral as well. So with you being in great shape, young female lady, I I think you're gonna have a great outcome. Honestly, you haven't sought any other treatment for this before, so this is gonna be our first trial run at this. I do expect it to go well, just based on who you are, your activities, your diet, your hobbies, your lack of drinking and bad decision making, as I would say. But yeah, I think that'll pretty much go well for you. We expect you to get better within 3 to 5 weeks. 4 weeks is kind of the standard care model for most people, and based on the best practice guidelines that are given through chiropractic boards associations. Some of the benefits that you may experience is just no pain, getting back to the things you like, being able to hang out with your friends, go for runs,
Okay.
party it up without having too much problems, no pinching neck pains that's going to send you home for the night. And that's our goal here, is just to get you out of pain and get you being your best self so that you can do the things that you love. Now, if you don't decide to do treatment with us, or you just decide to do no treatment at all, there could be some repercussions. With this type of pain, it encroaches on what we call the IVF, which is this little hole that your nerve roots or your nerves come out of from your spinal cord down into the periphery in your body. So this isn't always what occurs, but what can happen is radicular pain, as we call it, or pain that radiates down into your arms, and this can be quite painful, ranging from barely noticing it to intense burning in all of your digits, just depending on how bad it gets. At your age, it's going to start slow and just build into your late elderly age, and just keep progressing and progressing unless we do something about it at this time. Um, Risks to treatments include vertebral artery dissection, which is very low. You have more of a chance of having a stroke or an ischemic event, as we like to call them, with just taking an aspirin and just walking around the street doing daily activities. Tennis has one of the highest reported ones, just with the quick movements, whiplash, things like that. But there's a low association between chiropractic care, just like there is with medical care or any other type of care you'll get. Some other risks may include some muscle pain that you might feel, some tenderness, just due to how much work we are doing on the muscles. We are going to irritate the tissues because that's part of the healing cycle, is to irritate, get some of those cells that we get some of the cleanup cells in there to clean up some of the debris and issues that you might be having. And then from there, we're hoping that you can get to a healing state. that pain doesn't always happen, that irritation doesn't always occur, but it does occur occasionally with patients, and we need to inform you of this. Yeah, I think this care will work for you quite well, and yeah, I hope we can move forward and see each other more often.
Okay.
Do you have any questions for me at this time, Dee Dee?
No, I do not.
All right, thank you very much.
Thank you.